Okay, guys, so how are you guys doing? I am getting ready to leave. Today is Wednesday, the 22nd. I'm having surgery on the 24th. Sorry, I'm trying to get my lash together. And I am getting ready to head off to the airport. I'm driving. My son's got to switch lanes because when we get there, because he can drive. I don't want him driving. We're driving in my car, dropping me off to the airport. I am ready. Already contacted my recovery guy. I love him already. I can tell you already. I'm gonna tell you. I'm gonna do a full in-depth review, but just so you guys see, my hair looks like it's super puffy. I just try to curl so I don't have to put no heat nothing on it. You ready? Pick that up. Oh, you got yourself a snack. Now those headphones, you think you're gonna use those?
No, because I don't got that little.
Oh, good, perfect. So yeah, we're headed to the airport, and my son is driving me, and we are on our way. So I will start vlogging again when I get to the actual airport. Okay. So I just made it to Miami, Florida. I'm at the airport, and everybody's like, "It's so cold out here, so cold here," and I'm like, it's really not. I guess y'all guys had, the Floridians had cold weather the last few days, but I mean, I'm cool. It's not even cold. Y'all used to wearing shorts, so. I'm just waiting for Alex to come from the recovery house. He said he'll be here in a second. I'm not pressed, so I literally just told him he said he'll be here in a few minutes. He's around the corner, and I'm excited. So excited. I don't know. I'm not even nervous. Nothing. I watched Maleficent on the airplane, and the new one, and I felt what is the Mistress Evil, and I cried. This is the second time I watched this movie. It's the second, third. No, this is the third time because I went to the movies again to see it twice. Paid twice to see it, and this is my third time seeing it again. Out of all the movies I chose Maleficent again, and I cried again in the middle of the movie, and I was in the middle seat between two old men, and they're looking at me like, but I had an amazing flight. So excited. I'm so excited. So I'll hit you guys when I get to the recovery house and show you around, give you a tour. My phone is gonna die. I didn't do the airport because it was so packed. I don't even know for a Wednesday night. Why was there so many people leaving from Atlanta on Wednesday night? Anyway, I will see you guys when I get to the recovery house. Okay, and hang your stuff up in here. It's a nice big closet with a safe in there. Important items. And I got my own private bathroom. Just don't mind me, this is the before. So don't judge me. We get rid of all of this. And then here is the toilet. And the shower. It's clean, everything's super clean. It's a little dark in here. Let me see. Okay, there we go. Right. Everything's in here super clean. Okay. This before. Okay guys, so my bag looks a little messy right now, but I just want to kind of show you guys what I actually brought with me. I know you can only see a little bit, but let's get started. So, of course, I bought my slippers, all right? I bought my robe. You guys saw that. I don't know where that came from. I bought a book because I wanted some reading material. Try to catch my year. I heard this was a good year of Yes by Shonda Rhimes. Saying yes to everything for a full year. So I'm going to, within boundary. So I'm going to kind of start reading this. I bought this. I bought some nightgowns, some white t-shirts. I bought this and these from Walmart. Remember I said I was going to give me some white t-shirts, so I did that. I also bought a pair of Adidas pants, just loose-fitting pants, some more t-shirts, my paperwork that I need for my pre-op, which I'm taking with me today, some underwear that I bought from Walmart. These come as a pack. Some socks, my nightgowns, and then this is my bag of supplements. I showed you before, my little hair tools, and then my favorite moisturizer. This is by Corez. It's the pomegranate grenade. So I'm gonna put that on. Let me just dump this back in here because it's gonna be a mess. On the other side of things, this is the stuff I bought with me. So I bought Dial soap. So a little of that stuff. So I bought some Dial soap. As you can see, some gloves. I overpacked. My Hybrid Cleanse, that's what I'm going to use to wash with tonight. Because I have surgery tomorrow. I'm doing pre-op today. My baby wipes, wet ones, some gauze, some gloves. I really didn't have to pack this because they have everything. But I just want to make sure I had, so I overpacked. My Chucks, my Dial soap. Then in here I bought a shower cap. I didn't use that. My travel toothpaste, satin cap for my hair, alcohol wipes. I showed you this, my pee cup. I bought some white washcloths to bring with me, some Q-tips, some wound wash, showed you already, cold lace. There's some hair ties. Oh, sorry, it's messy. Some Germ X, some tape, paper tape, and some other type of tape. I forgot the name of it. It's toothpaste, extra toothpaste. So my level of necessities, in case I need it. But that's pretty much it. Now look at my thing. I made a mess. I'm gonna clean this back up and then head out for pre-op today. Oh, can I have coffee? Go.
Yeah. Negro. Con la crema.
Yes.
Okay.
Thank you.
¿Quieres un sándwich?
No food.
Okay.
No food, just coffee.
Okay.
Thank you. How you guys? So, you want to be on there? Do you want to be on there or no? Shit, ain't nobody worried about me. So, I'm at the recovery house, at Resort Recovery, and this is Janet. Hey, girl.
Hey, girl.
So, she had her BBL lipo with Dowback, and this is for what, day 4? She's moving around. She's not even fluffed yet. Nothing. And she looks amazing. She looks good. She's happy. I am happy. I'm ecstatic. Everybody says that Dowback is amazing, sweet. We just were talking about the staff.
Right.
So don't get discouraged by that. You just have to be on top of your game when it comes to the staff and trying to make sure all your quote is right, everything. So I'm going in today for pre-op and I'm going to pay. I'm sitting here waiting for Alex to come pick us up. She's leaving today, going back home. But it was nice. All the girls so far have just been amazing. Their own little journey, own little recovery to bettering themselves, looking amazing. And that's pretty much it. Yes, welcome to the MIA. Hey, Alex. So this is Alex. We're Resort Recovery. And he is bomb. He's taking the girls, dropping us off some to the airport and meet a pre-op. And the girls got their booty out. Ow, ow, ow. Look, booty, 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 booty rocking everywhere. So cute. They're so cute. I know that's right. You're not going to pay all that money to sit on it. So,
Yeah.
anything you want to say, Alex?
Just welcome to Resort Recovery. As always, we're here to help out and make sure your recovery process is the best.
And he's been such a gentleman. He's been taking us back and forth, and it's been amazing. He has been amazing, hands down. Best recovery house.
Yes, always.
In Miami. So you guys, you're gonna have to check him out. He's taking us, he's been up since 6 o'clock, 5 o'clock early this morning, taking girls back and forth wherever they have to go. Prescription pickups, everything. And I just saw Aria this morning, the masseuse. Yeah, so I'm excited to get my massage. She's like, she'll be back on Saturday to get my massage. So we're headed to our pre-op, you guys, and I am excited. So I'm getting ready to go into Glamorous Life, which is Dr. Dowback's office. She has her own office outside of New Life, so that's where I'm going. I'm doing my pre-op there, my payment, all of that stuff. I just got dropped off on West Flagler Street, and we're about to walk in right now. This is what it looks like. So I'm excited.
Used to that situation with the platelets and use it with the hemoglobin, but not the platelets. This is why I'm recommending that you talk with your doctor, okay, about the platelets. Anyway, you have my phone number.
And then I need to see if Michelle's gonna refund.
Okay, so I'm back from my post-op. It's about 4:15. I left out here like 11 o'clock. The only reason why I stayed because only took a while. I got there early. Pre-op is usually between 12:30 and 3. The day prior to your surgery. Dr. Christinedowback today. She is amazing, sweetheart, knowledgeable. She gave me confirmation. I felt at ease, without a doubt. The front office staff, no problem. Easy to answer whatever questions you have. Now, the surgical coordinator, Juliet, is a different story. There's been several complaints. Either one or two things need to happen. Either she needs more help doing her job, or she just needs to do her job from start to finish effectively and efficiently. Because if you are not on top of your stuff, you'll be wasting your time, wasting your money, for you to come out there and you not have all your stuff together. Even prior to me coming out here, it was like, me coming out here, I did my blood work the 26th of December, and here I am. Even still, the day before it was raining a little bit, you guys, so my hair's a mess. But it was insane because they didn't have, she kept on saying she didn't get the paperwork, she didn't get the blood work. I faxed it to her right as I'm faxing from my job. She's like, oh, if you send it by email to me and it doesn't come from your email account that I have on file, then it's not, like, it automatically doesn't get it, it automatically exits out of system, all these extra qualifications, and they still didn't have it. When I got here today, I even called her yesterday and told her that if they didn't have it together by the time I got here, it was going to be a problem. And after I spent my money. So I came out here. Luckily, I didn't have that problem today. But there was other girls there who were complaining about the same exact thing. And I don't, not to put anything on anybody, be informed that don't let that discourage you. Just make sure you're on top of your stuff when coming here. Make sure you have all your paperwork, all your blood work. Bring copies. I don't care if she said that she has it. Still bring all your stuff. when I was even talking to Dr. Dowback, I met her and did my consultation. She wrote everything down in the book, where I was staying, where I was, if they're treating me okay, who's bringing me, all the ins and outs, where I'm from, how much I weigh. They do your BMI check, height, weight. They don't skip on that. I had everything done and completed, but my CBC didn't have a platelets or something. They didn't do CBC with platelets, which it normally does. So they wanted me to redo it. The anesthesiologist looked at it today and wanted me to repeat the CBC. So here it is, 4:15. I'm just getting back from them today. And got something to eat because she had made me like a salmon salad. So supposed to text me this evening and let me know what time I'm supposed to be there. I've already seen Dr. Christine Dowback. She's given me my prescriptions. She showed me my outlook. She did an overall exam of me, look like, what she's able to do, what she can do. All that my stomach's gonna be flat. My tires, the love handles, all that stuff is gonna be gone. And I told her I use all the fat. Okay, do not leave nothing on the table. All right, pump that butt up. Okay, I don't care if it's on exaggerative. Okay, we need exaggerative. I'm not paying all this money to give me a natural butt. So I don't care if it's out of this world, astronomical for real. I really want, give me all the smoke. Okay, I want all the smoke. So I am gonna bring my wish pictures tomorrow because I didn't show her them, but she said I could bring them. They'll ask me in the morning, so they told me to bring my wish pictures in the morning. They are supposed to text you today to let you know what time you have to be there in the morning. You're supposed to come tomorrow. Bring your robe, slippers, that kind of thing prepared. Even my prescriptions already. So they gave me Bactrim DS. They gave you Percocet. They give you. Yes, I have 4 prescriptions over there. Bactrim, Percocet, Diflucan for yeast. I guess because you're taking all the antibiotics. And then there's something else. One more. Let me just double check real quick. Because it's Bactrim, Percocet, Diflucan, Zofran. Zofran is given for nausea. So, see something. The pictures, because everybody doesn't post pictures. We normally go off the pictures off of Instagram. Let me tell you something. Everybody's body who I've seen there, like at the facility, across the board. She made them. She filled them out, pumped their butts. It's the butt that you want. Like, no BS, no shortening. She gives you the body and the butt that you want. So if you're ever even thinking about considering her, she gives you the results that you want. When I went in there, she looked at me. She was like, "Oh, that stomach's gonna be gone. The side level handles again. You have great elasticity." She said, "I can already tell by your look, you're gonna already, the way you're shaped, it's already gonna be filling out." And I was like, my main concern is that I have no projection. Them girls that came in today, everybody's body. I seen about 5 or 6 girls that came in here for their post-op massages, their clearance letter because they were leaving, because they're getting on a flight. Everybody's walking, no problem. I think a lot has to do with the cell saver. A lot of people saying some of them, if they're limped over a little bit, everybody's walking like as if they've already had surgery, and they've had surgery within 2 to 3 days, 3 days, 4 days. Everybody's good. She wants everybody to stay for like at least 3 to 5 days. Some of the girls stay for 3 to 5 days. You don't have to stay for a full 5 days. So that, I want to let y'all guys know that. Also, I thought it was very interesting because I asked a lot of questions at the front desk while I was there waiting. Christine Dowback does not do surgeries all day. She does the surgeries only in the morning. She does consultations in the afternoon. That's why they had you come from 12 to 3:30. And she checks over the other patients that come in after they have surgery. She does surgery, I think, every day. But she only does them from 5 in the morning to noon. The most she takes is 5. She does. I asked how many surgeries she does a day. They said 5 to 6 patients a day. She does not do a full load of patients. I know that was one of the concerns. I was listening to a lot of people saying because you're a little older and she's getting up there in age and we're concerned about. Let me tell you something. I don't have a concern without a doubt that she is going to perform because the girls that I seen in there today, their bodies was hitting, okay? Everybody looked like a dime. Like, I'm not even lying. Like, I give credit when credit's due. She knows exactly what she's doing. I am 5'5", well, I'm 5'5" and a half, and I weigh 196, which is a lot, and even for me. But I told her this chin's gonna go as well. Chin is getting sucked tomorrow, and my stomach, and I'm doing BBL. Even the girl in the front, one of the reception, she just had hers done. What, Friday? I think it is. She says it'll be a full week. Body looks fitted, like formed, without a doubt. I cannot even say enough and stress enough. Excuse me. She knows exactly what she's doing. Put your deposit down and get your stuff done. What else? I think that's pretty much it, you guys. So it's the morning of my surgery. Sorry, I look beat. I am excited. I don't know what's wrong with me because most people are not like that, but you've been waiting for something for a long time coming. Sorry, I put the water on. Because I was getting my stuff. And I said, you know, let me just film the rest of this part. Sorry, I don't know what's happening, but I'm so excited. My alarm is actually currently now 3:01. It'll be there at 5:30, so I'm so excited. I'm gonna get in my shower. This is the Hyper Cleanse. I just put the top on, and this is what you have to, so I washed last night using the dial, but this morning you have to use this to cleanse it. So I'll be doing this, I don't know how, because I don't use just a liquid, so I'm gonna do as they say, and we will see, okay? So I will see you guys in a few minutes before I go to surgery, when I get there, okay? I look. I could be looking better, but it's okay. So I'm already ready now. I've washed with the Hyper Cleanse. I did like 6-7 passes. On my face, my skin's a little irritated because of it. I did underneath my arms, everything. So I'm ready to go. I'm waiting on my ride. I'm still early, so I feel refreshed. I feel amazing. I feel ready. That's what I feel. It's a cute little room. I'm just ready, you guys. And it feels good. I'm gonna put this on. I'm not even gonna wear, like, I have on a shirt and some sweatpants. See? I have some sweatpants on. All of this is going to go. All of this is going to be gone. She's like, all of this is going to be gone. My love handles. This is what I look like on the bottom. You can see I do not. I've tried losing this 1,000 more times. Just won't go anywhere. So, baby, she's going, and then look how flatty flat that is. We're about to pump it up. But yeah, I'm ready. I feel like my results will be amazing already. I don't know. I just know it. I just know it. After people I seen yesterday, I just know it. So that's it, you guys. I will see y'all at the clinic this morning. Bye, you guys. Motherfucker, I mean, okay. I have to go back to office and it's 5:15, 5:30. I'm walked up and it's about to, I'm doing my chin too. It's about to go down. It's about to get real. I'm excited. Who else is excited? Because I know God is with me. I'm happy. And I prayed about it. Oh, yes, indeed. Yes, indeedy. I'm excited. Suck the fat up. And we're going to get down. I'm so to the bed. I'm excited. Yes, indeed. I'll see you guys soon. Okay, guys, so a little call button. On my chin lipo, my BBL, I just got up. I should have took pictures, but I didn't. My whole forehead is bloody. But it's fine, because today is day 1. I'm feeling better after the drugs. They give you Percocet. Oxycodone is funny, because some of the girls bought their own pain meds as well. Because she gives you Percocet, 5 325s, and gives you 20 of them. So some of the girls came out here with their own meds as well. But I love it. Everybody's taking their time. Dr. Dowback. After, sorry, I'm on drugs right now. I've had some soup. I've got up and walked. You're supposed to walk every 2 hours. So I told the girl to come get me. And 2 hours is probably around 5 something now. 4 something. So Dr. Dowback was such a sweetheart, even in the surgery room. She came in there. They put the IV in. She was talking to me. She was holding my face. She's rubbing my face. It'll be all fine. It was going to be a wonderful day. Like her bedside manner. I work in healthcare. I've worked with physicians my whole entire life. And side by side with physicians, because I'm a medical assistant. And her bedside manner, I love. She really cares about the patients. I highly recommend her. From the results I've seen after you had your procedure, all I do is remember going to sleep, waking up, getting in the van. Sorry. My recovery guy came in. So recovery house that does transportation was there, put me in the back, laid me on my stomach, came in, helped me, assist me. Feeling much better since I have meds. And it really just kind of calms you in a sense. I do feel some slight, pain, but not like, I've already been getting up, walking already today, sleeping, walking, drinking. They made me chicken soup. I haven't been eating meat, so that's fine, cause it's not like it's gonna make me sick. I had chicken soup, it was so good. And then I've been drinking a lot of juice, pineapple juice. They made their pineapple juice from scratch. I'm like, huh? So good. Oh my God. The rest of the girls have been coming in, checking on me, make sure I'm okay. They made me feel real at home here. Resort Recovery, I highly recommend it. I'm in my own room. I have a call button. They come when I call. I like it. I love it. I love the customer service. I love the care. And after your surgery, they send you a text of all the pictures that you had done, your body. They send you the pictures before and after. And the way she did me, I know I'm gonna love the results. Everybody kept saying, wow. I think the most you can take out is $4,000 in the state of Florida. But she's so savers, she did a lot. And she gave me more hips. I don't know if you know, guys, I'm already hippie. But you can't really see when your stomach is in the way. So, just had them come in and turn the fan on. That's why you see my hair blowing.
They keep the temperature warm, which is nice and comforting because when you come back from surgery, you need that. And overall, I've been loving my stay. I've been loving, and I just wanted to come in here, you guys, and tell y'all it's a success. I love that to give you a detailed report of how much she took out, how much she re-injected, where she injected it. And when the other girls came here, she was talking to me. Everybody's like, your body looks good. Oh my gosh. So I was flatter than the foot than the back, but now, we just didn't even fluff up. Well proportioned for my body. I'm thankful. I had to do it. I stayed determined. I faced my fears with the help of God. For he is the true and living God and gives me strength. And I had not been for him by my side. The attentive here. Thank you, Lord. So I'll check back with you guys when I start walking. I get up again. My faja just got up to pee. All right? Okay. Okay, guys. So I got my face bandaged. It's the next day, the 25th, Saturday. I'm getting out of bed because I have to go to post-op. I'm completely soiled in my clothes, and I don't want to go like this, but I also don't want to take the faja off. I'm gonna kind of show you guys if I can. I have like no stomach. You can kind of see. I'm soiled back there. I'm soiled right there. I don't know if y'all can see that, but I'm trying. I have compression stockings on. But a lot of this is that red stuff, not just blood, that they use to clean with you, so I'm trying to walk around. But I want to just update you guys. I just took some pain pills. So it's not so bad. It's just that because I'm lipoed, I need my arms. I get up every 2 hours and walk, but it's so stiff I need to even I need my armpits. So I'm gonna check back in with you guys. Now you can barely see me, but this is part of it. Honestly, I feel like I'm not having any pain. It's just some discomfort. I just took my pain pills. But I'll check back in with y'all in a second. My face is swollen. Because I had lipo enough to keep this thing on 24/7. I'm trying to get up and walk around. I didn't show you guys a massage yesterday because it was so brutal. I couldn't even try to get outside. Massage yesterday. I needed it to get all the fluid out. I felt better after the fluid, but at the time, I have my little call button with me. At the time, I could not. You can kind of see. My thing is soaked, but it's not soaked now. That was from the other day. They washed it. They didn't use peroxide to wash it, so it looks like this. But I already have enough faja. Like, I'm so tucked in. But I'm still swollen, as you can see.
feels good out here, Miami. I don't have no bra on. Oh. Starting to itch a little bit. But for the most part, I'm feeling better today. I'm just a little sore because she lipoed all of this in here. Give me a little bit more extra hips. But this is all gone, but this was full of fluid, and Aria, who did my massages, came in. Oh my God, it was so brutal. Oh, that first massage was brutal. Because you just lipo this whole entire thing, she moved all the fluid from the back to the front, and then it just came out draining. Dowback doesn't give you drains, so I saw one of the other girls here that went to Jolie and used Butler? Something like that. And she had drains, she went home with drains. Overall, the girls have been here, like the sisters, the surgery sisters, everybody that's been here has been pretty good. They've been loving, sweet, they're passing on their supplies, their thing, but I don't need it because I brought all my stuff, but their pills, it's just been better than I thought. Even now, it's crazy because even now, me sitting here and having minor pain, I would still do it again. Like, everybody's always nervous, or I'm telling you, she put me to sleep. I woke up, and when you get over that and you wake up, you just gotta do it. You just do what you have to do. But I feel good. I just heard the news that Kobe Bryant passed a helicopter ride, and it's sad. We just got the news like 30 minutes ago. It's on TMZ. Everybody on board was dead, so my condolences go out to his family. Crystal. Oh, the surgery girl, she had a tummy tuck. Who did your tummy tuck? Ortega. Oh, Dr. Ortega. What hospital? Spectrum Aesthetics. She's been here. She's gonna be here till next Saturday. I'm leaving on Tuesday. She's getting around though. She's had her massages. We have someone else coming tonight to do our massages. But what it does is help drain all the fluid. This is gonna be sucked all the way in. All the way in. See it? This is Dr. Dowback. Sorry if you can see my little butt. The zip goes all the way down from all the way up. Ugh. I'm excited though once the sun goes down. It feels good out here though. You need to come out here and get some sun, even though we're not supposed to be in the sun, I think. You're not supposed to be in the sun, I think, for like 6 months, but I mean, it's too nice not to be in here. Would you draining your pump? Crystal already talking about oxtails. I'm like, I don't even know how she even eat. I can't even think about that. No, you don't want just want one. After tummy tuck, you don't want none. Anyway. So, my massage masseuse comes here later on this evening. I'll try to see if I can film it. I look crazy right now. But I'm gonna sit out here and enjoy this air right now. Oh. Alright guys, so I just woke up not too long ago because I'm feeling stiff. When I lay flat on my bed, it'd be too fluffy with the pillow, so sometimes I have to lay without the pillow. Probably been in this room probably now for 30 minutes, a little bit more than that. My masseuse is supposed to be coming tonight. She told us that she was gonna be here later tonight, and I said it's fine. As long as we have a massage tonight, which helps relieve a lot of the pressure, the tension, the fluid. I don't have drains. Dr. Dowback doesn't do drains. So once the fluid builds up, they push it all the way out. I try to want to get an ETA because they usually tell me what time they're going to do it so that way I can take my pain meds and be ready. But I feel better like bending over on the couch. My butt is up in the air as you can see. But I'm like, this is a low couch, so my knees are on the floor underneath the pillow. I mean, you're on top of a pillow. I don't feel like major pain. I just feel probably just discomfort mainly. My butt, and this, you're thinking of all different types of ways of how to sit and be comfortable, and you think they lipo underneath here too, so this is stiff. But I feel like the more that I exercise it out, I'll be okay. Oh, I have my alarm thing on. A call button. Oh. But I will be back to you guys tonight when it's time for me to get my massage, okay? It's probably around 6 something. 7 something, sorry, 7:30. All right? Okay. Hi, you guys. I'm looking a hot mess. I took my wrap off of my chin. Oh, because I was trying to eat, but I'm about to put it back on. I'm trying to be in high vibes. And I am. I just try to stay off social media, but because I'm in a predicament I'm in, that I'm using it as a tool to help me pass the day by. And all over is Kobe Bryant and his daughter, and it's bothering me. Even when we take risks, even going outside the house, or even having surgery or anything like that, we take a risk. I mean, it might be minimal, but you know, you think that everything's gonna be okay, it's always gonna be okay. It's something small that you do every single day. A random act can just be the end. I text my baby telling him how much I love him. I always do anyway, but even more, hugging our family a little bit tighter. And be forgiving. Not be foolish, forgiving. Because at the end, you live this life by yourself and you die this life by yourself. And not just Kobe Bryant and his daughter, but the other people who lost their lives in that helicopter. I'm eating breakfast this morning. I haven't really been eating. I mean, I need to eat. I'm doing better. I'm having oatmeal this morning with some bread because I need to eat. That's the only kind of food I really want to eat. That they've been making other types of food, but I can't eat that. Even with the fish and like grilled fish and salmon and salad and all kinds of meals, but I can't eat that stuff. And then they made like beef with like, what was it, mashed potatoes the other night, and like vegetables. I can't eat none of that stuff. I mean, stuff like this, oatmeal. I've asked for, requested this, and soup. So staying here, been absolutely wonderful because it's quiet. Right now, there's only one girl, and I think she brought a companion with her cousin. But other than that, another girl, I think it's at her follow-up appointment. I know she left out early this morning. I am eating foods like this because it helped me feel better. And you have to eat food in order to take your medicine, because I've been taking my medicine and not like eating as much as I should. And it's been making me nauseous. I really feel like I'm having a baby all over again, or I just had a baby. That's exactly the feeling that you had. Because my stomach, you know, it was big at one point and now it's flat. And then you have that, it feels like loose skin, kind of. Like how you would have after your baby. That's exactly how it feels. It's sore around the other premise because they lipo the whole thing, but I had to put stuff here because the straps, like my skin is thin because after the lipo, so the straps like irritating, they left burn marks. So I've been putting like pads underneath those. I have my faja on. Last night the girl came in, it's a different girl, came in to do my massage. She used my arnica gel. And she used baby oil. And that shit, it felt okay going down just to smooth it. But I didn't take a shower afterwards. She's like, you should take a shower. She packed me so tight with the boards. I was not comfortable at all last night. So I had to take all that stuff off at 4 o'clock in the morning, 4:45. I got up. I took all that stuff off because she came around 9. 4:45, I took all that stuff off. Got in the shower. Got in the shower and I had to I think I used dial soap, clean myself off. I felt so much better after that and I repackaged myself. Like your stomach is kind of like hanging in a sense, but that's all gonna contract back. I'm not even worried about it. My stomach looks nasty. Like I told you, like you had a baby, but I ain't worried about it because I know I'm gonna get my stomach back tight. But my shape otherwise, I love the way Dr. Dowback shaped me, and I'm gonna be honest with you, I like the results so far. I don't know, I'm not even plumped or nothing yet, but I like the way he shaped me. I'm just gonna continue to wear my faja every day, keep my stomach flat. I also forgot 2 of my things I sit on. Not sit on, but put underneath your thighs, your legs, so you don't sit on your butt. So I can sit down in my seat for a small period of time tomorrow. I'm gonna see how that feels. I know this shit's gonna be painful, but I'm not sitting on my butt. That's not gonna happen. I will stand the whole fucking flight, and that's a fact. Like, don't be. I'm slow motion. This is gonna be all gone. These are just my foams. I'm telling you, it's like no stomach, none. But I'm so puffy in my face. I look a hot mess. I don't even care. Sorry, you guys. This is the raw and uncut real deal. I will be talking to you soon. Okay, guys. So 7:45, the morning of I look a hot ass mess. The morning of my departure. I don't know, bro. Excuse my hair. It looks a hot ass mess. But it's so good. I'm in the bathroom right now. I got my cycle yesterday. To be honest with you, after getting my cycle, I feel much better. Look, my hair. That's all over my head. This stupid hot thing. I hope they let me on the airplane, because I don't look like my picture. What they gonna do? Turn me around. They did before, not me, but I think some Asians had got their face done somewhere else, Korea, I don't know, something. I don't know. But they wouldn't let them get on the airplane because they didn't look like their picture. And you don't even think nothing about that. So, my stomach is kind of hurting. I feel like, because I have to go to the bathroom. I have to excrete some waste, number 2. But it's hard for me to go. And my cycle came, so that's like, ugh. Overall, though, besides that, I know it's too much information. But this is the name of the game. I have my panties on my pad, so. But I do feel much better. Honestly, bleeding. I feel like the people who have drains, because Dr. Dowback doesn't do drains, I feel like the people who have drains walk faster than people who don't, because you have more energy when you're draining. You have to get the fluid off of you. So Dr. Dowback doesn't do drains, but you have to have your massages. And in the package, it comes with 3 massages. But I'm not going up there because it's going to be extra charge for me to go up there every single day. So I paid for somebody else to come to the house to do massages.
And I'm glad I did that. I keep on checking because I feel like I'm leaking, but not my body. I'm just being honest, this is the TMI. This is going to be too much information for y'all. Look, I'm already on here looking a hot ass mess. But don't even worry, because overall result is going to be bomb. I'm telling you, I can see it already. I'm about to show you guys my faja stain. They didn't wash it with peroxide. Everybody knows if you wash peroxide, well, most people know it, especially if you're in the medical field. If you wash anything, even if you get blood in any type of blood in your garments, you put peroxide on it and it lifts, comes to the surface. You could do that. She should wash my thing. I probably could still do it. We'll see. I'll do it when I get home. It was just to me last night. I got up, I walked. I slept good. Last night I walked. I only did Tylenol. And I did every 6 hours, 2 Tylenols. I could probably bump it up to 3. But I was comfortable. I didn't, no oxycodone, no Percocet, no nothing. And I was okay. It feels like you have a sunburn. Like, be honest with you. Lipo feels like a sunburn all over your body, and then you're compressing it. So basically, they melted all the fat away, and now you're forming your new body. That's basically what the whole thing is. Because they put the candela in those areas, they burn all that fat, right? Goes down, and that's why your body feels like sunburn. Then you have to have massages to get the fluid out, to push it out, push it out, push it out. Because you're excreting those ways, that's why you feel energetic and all the other stuff. You'll still be sore. But basically, and then you wear your foams and stuff to mold you back into a new shape. That's really what the plastic surgery is. I'm going to show you, even though my faja is stained, I have a stage 2 already. I bought it. M&D is a Colombian brand. And it's a XXX, 3X. Basically, that's what the size of my faja is now. But when the other consultants came by from another thing that's going to use this recovery center, she came back and she was like, your faja's going to be too big. Your faja is too big right now. I just went down to the one strap yesterday after my massage. I'm not rushing my body to get into a tight. I'm going to compress it, but I'm going to compress my body. At the time that's done for me, I'm not even a week, and this lady consultant came over bragging and brought one of her patients saying, oh, she's been in 3 fajas already. Okay, well, that's her. Everybody's body is different. You're not convincing me, nothing, especially I'm in the medical field, and I know for a fact everybody's body doesn't do the same thing, because we all don't absorb product the same. What Oxycontin does for me, it might not do for you, because after a while, me taking it gives me nightmares. So that's it. I just want to document that and just to get this content on here, how I'm feeling. I'm feeling amazing, though. I could tell you that for day 4, I'm feeling amazing. Yesterday is completely different from how I was feeling yesterday. And when you sleep on them heavy drugs, you feel groggy. So the less you take them drugs, the better you are. If you can tolerate through it, it's only temporary through a temporary pain. It's easier said than done, but it's possible. Because, no. Oxycodone, I feel like I was sleeping heavy, and I was like groggy, and I couldn't even move. I couldn't even see it all the way up. But I'm about to show you. Now, minus the boobs, okay? I still want my boobs done, but okay, so I got my board here. This is what I'm supposed to sit on the airport. We'll see. I try to sit on this. I put the blue chucks over here, over this, so I can sit on it to go to the bathroom. I ain't that comfortable yet, but by the time I finish pumping and maneuvering this body, molding, it'll look like something. Trust me. Don't be alarmed. This is dry blood, but this is washed. So because you know there's no faja. So you can see. Like, say if I would have my things up here, these are granny drawers, but you can see. I'm gonna get this all the way down. And then this, you just keep this on for molding purposes. But it's a better view. bring this all the way down. I'm actually on my first row today. Well, yesterday. So I'm gonna try to get. I have to get my stage 2. I'm not rushing by. What is it? Friday. I'm gonna put my cause Friday will be a week. I'm gonna try to get my stage 2. I actually need to call them this morning to see if I need to come back because I'm leaving today. On the post-op, just the nurse checks you, takes your bandages off, make sure you're okay, take pictures. And then you're gonna give you a letter from the doctor saying you can go. So, anyway, I'm gonna call them, see if I gotta come in this morning. Thank you guys for the journey. I will be doing updates and follow-ups. So subscribe, share, like, contact. And I'm gonna show you pictures of me before, because I ain't had none until just here. It's funny, because even that was full, people like, now they have to feed the fat. And they said now is not the time to lose weight, you have to feed the fat. Well, that fat sells, so I'm gonna have to feed the fat. Alright guys, I'm signing out and I will see y'all on my way. So I'm in the airport and everybody's looking at me like I got 10 fucking heads. But I'm unbothered. Okay. What's wrong with her? I don't know if you can see him, but I'm wearing my Yeezys. I got a wheelchair to come up here, but we'll see. Oh, these sneezing motherfuckers. The worst place to be in the fucking airport. I should have worn a mask. Motherfuckers is crazy. But this is it. I'm at my gate and I'm here early. So I got a few moments. Anyway, I'm excited. I'm ready to get back home. And that's pretty much it. Busy at the airport.